Today's topic is hepatitis.
Assalamualaikum warahmatullahi wabarakatuh. We from Group 9 will do health promotion regarding hepatitis. Whose member? I am Febmiyana Ermisam Putri, Anisa, Salsa, Nabila, Rona Shaumi, Elga Jihan, and Muthi'ah Khairunnisa. The first definition of hepatitis. Hepatitis is inflammation and liver injury due to hepatic reaction to various conditions, especially viruses, drug, and alcohol. Hepatitis is a dominant systemic infection that attacks the liver. Viral hepatitis is a term used for viral hepatic infection with necrosis in and inflammation of liver cells they products, a unique set of clinical, biochemical, and cellular changes. Hepatitis is a process of inflammation of the tissue. Hepatitis in lay language is often referred to as liver or jaundice. The definition of liver itself is actually derived from the Dutch language, which means the liver, not the liver disease. Furthermore, regarding causes will be continued by my colleague Muthi'ah Khairunnisa.
Causes. First, hepatitis A can be infected through food or drink contaminated with the A virus. Second, hepatitis B can be infected through sexual intercourse or sharing needle contaminated with the B. Third, hepatitis C spread when blood that is exposed to or contaminated with the hepatitis C virus enters another person's bloodstream. Fourth, hepatitis D caused by hepatitis delta virus infection. This virus is incomplete type of virus and requires the help of whole hepatitis B virus to develop. Fifth, hepatitis E can be infected through blood transfusion, pregnant women to fetus, animals infected with the HEV virus, and consuming water contaminated with the HEV virus. Next will be informed by my friend.
Okay guys, next sign and symptom of hepatitis. Number 1, hepatitis A. Hepatitis A can cause several symptoms including tired easily, nausea and vomiting, apparent abdominal pain, diarrhea, yellow of the skin and whitish of the eyes, loss of appetite and fever. Okay guys, next hepatitis B. Hepatitis B, same as hepatitis A, but sometimes hepatitis B also A accompanied by other symptoms such as stomach pain, especially in the upper right, bone and muscle pain, and dirty is whitish. Okay, number 3, hepatitis C. Sometimes hepatitis C does not show typical symptoms, but hepatitis C symptoms are similar to hepatitis A and hepatitis B. Okay, number 4, hepatitis D. The symptoms shown by hepatitis D are the same as those of hepatitis A, B, and C. Several studies show that complication of cirrhosis of liver failure will occur more quickly if a person has hepatitis B and hepatitis D at the same time. Okay, next number 5, hepatitis E. Symptoms of hepatitis E can appear about 2 to 6 weeks after the virus attack the surface body. Symptoms of hepatitis E are generally similar to the symptoms of other types of hepatitis, namely fever, get tired easily, and dark urine. Okay, next we'll continue by my friend.
Thank you for the time. Next, I will explain about any treatment for hepatitis. There are medical and non-medical treatment for hepatitis. First, I will mention what are the medical treatment for hepatitis. For hepatitis A and E do not require special treatments. It only treats the existing symptoms. For example, if fever is given paracetamol, and if nauseous is given metoclopramide. Next, for hepatitis B, can be treated with adefovir, entecavir, lamivudine, and telbifudine. And for hepatitis C, can be treated with sofosbuvir, cimeprevir, ribavirin, lenacapavir, velpatasvir. And for hepatitis D, currently there is no effective treatment. Okay, that's all for medical treatment for hepatitis. All of that must be based on doctor dose. Next, for non-medical treatment, you can prevent this disease by first, avoid alcohol consumption. The second, avoid taking drugs if you don't need it. Third, reduce intake of fatty foods. Fourth, maintain an ideal body weight. And the last one, avoid stress and physical fatigue. Okay, that's all the types of treatment for hepatitis. And next, how to prevent hepatitis will be explained by Rona.
Okay, next, prevention of hepatitis. Number 1, hepatitis A. We can prevent it with vaccination. Number 2, hepatitis B. In addition to vaccination, also avoid with blood and other body fluids such as object use and related sex. Number 3, hepatitis C. Don't share needles and be careful if you want to have sex. Number 4, hepatitis D. Don't share personal use and avoid unsterile medical procedures. And the last, hepatitis E. Avoid undercooked food and maintain personal hygiene and belongings. Alright, enough of the discussion about hepatitis from our group. Thank you for your attention and wassalamualaikum warahmatullahi wabarakatuh.